Hello, everyone. I'm Mindy Kim, and I'm a third year medical student from Wayne State. Our project is on the prevalence of STK11 mutation and its association with solid tumor survival. We began to study STK11 mutation because of its role in non small cell lung cancer. While a subset of non small cell lung cancer patients find considerable clinical benefit with immune checkpoint inhibitors and show complete radiographic response, most non small cell lung cancer patients fail to obtain durable responses to immune checkpoint inhibitors. A gene that may be playing a role in how non-small cell lung cancer patients will respond to immune checkpoint inhibitors is STK11. STK11, also known as liver kinase B1, LKB1, encodes serine threonine kinase and is involved in cell metabolism, regulation, cellular growth, and polarity. 26% of NACLC patients have STK11 mutation, and studies have found that STK11 mutation predicts poor outcome from immune checkpoint inhibitors in non-small cell lung cancer patients. So we know that STK11 plays a role in lung cancer, but we want to ask, does STK11 play a role in other cancers? The purpose of this study is to examine the prevalence of STK11 mutation in other solid tumor types and its association with overall survival. We hypothesize that many cancer types frequently have STK11 mutation, and STK mutation leads to worse overall survival. We extracted data from the Cancer Genome Atlas, TCGA. We have two groups of interest, which are lung cancer patients and non-lung cancer patients. We have 899 patients in the lung group and 8,478 patients in the non-lung group. I then used R and JMP software to perform the analyses. Through TCGA, we found that lung adenocarcinoma was most frequently associated with STK11 mutation, followed by cervical, uterine, and pancreas cancer. We then compared the frequency of STK11 aberration in lung cancer and non-lung cancer. This is interesting because lung cancer has much higher frequency of deep shallow deletion and mutation compared to non-lung cancer. We then looked at the survival curve analysis for lung and non-lung cancer with STK11 mutation or deletion. Mutation of STK11 in lung cancer had a particularly deleterious effect on lung cancer survival, whereas STK11 deletion in non-lung cancer patients was associated with worse survival compared to STK11 um, mutation group and the wild type group. Okay. Then we looked at the fraction genome altered, which indicates that higher numbers have more overall alterations in the genome. In both lung and non-lung cancer, we found that STK11 gene deletion and STK11 mutation had higher fraction genome alter than wild type, suggesting that this STK11 gene may be relevant as a marker for overall genome alteration. So for our discussion, we found that STK11 mutation is common in lung, cervical, uterine, and pancreas cancer. There is higher frequency of deletion and mutation of STK11 in lung cancer compared to non-lung cancer. The main clinical impact of this project is that it suggests that STK11 aberration is associated with decreased overall lung survival in lung and non-lung cancer patients. Therefore, assessment of this STK11 gene expression may be useful for predicting prognosis in these cancer patients. Okay, we would like to acknowledge some of the limitations, including having no data on treatment, stage of diagnosis, clinical pathologic differences, and no way to control for confounders. So we believe that STK11 may be used as a prognostic marker. However, large-scale studies are needed to better examine the underlying mechanism behind how STK11 may influence cancer prognosis and differential impact of STK11 mutation compared to deletion. All right, and I would like to also thank my two mentors on this project, Dr. Hirva Mamdani and Dr. Alicia Bolig Fisher. Thank you.